Hi there, this is Cassie Cannon of Cannon Psychology. And one question I wanted to answer was, what is an EMDR session even like? And that's a very common question, especially if you are really nervous about addressing your past trauma history. You kind of want to know what you're getting into before you dive in. And so, most people, when they actually think about doing EMDR, they think that it's really only one particular aspect, which is processing or reprocessing the traumatic memory. But it's actually an 8-phase process. And the part that most people think about is phase 4, where you start with desensitization, which is taking that memory and reprocessing it so that the memory doesn't hold the same amount of disturbance, energy, or charge as it once did. But before you get there, you have to do phase 1, which is an in-depth intake evaluation where you are looking at history, present triggers, future goals. You're looking at strengths, barriers, and what specifically you need, because every client is very, very different. So you're not going to do the same cookie cutter protocol with each person. The second phase, what you're doing is you're preparing and you're resourcing. So resourcing really just means making sure that you as a client are able to kind of come back to a neutral state if you find that you are really activated and emotional and it's really uncomfortable for you in the processing portion. We want you to have a lot of tools to be able to kind of ground and bring you back. Dissociation is another concept altogether, which I will put together another blog at some point, but it's not uncommon for people to dissociate during EMDR, and so our goal is to keep you in what's called a window of tolerance, meaning that you're not so activated that your brain freezes and that you can't actually continue to work on the memory, and we also don't want you so unactivated that you're not actually accessing the memory. So we want to keep you in a window of tolerance. It's not that dissociation is bad in and of itself, because we all do it to some degree, but we want to keep you in a window of tolerance so that your brain can keep doing the work that it already knows how to do. So that's phase 2, is where we're making sure that you have the resources that you need so that you can be successful in the next section. So typically phase 3, it's called assessment, and it's a specific assessment of the target that you're working on. So if you have decided to work on a particular memory, maybe it was a car accident, maybe it was a sexual assault, or what have you, phase 3 and 4 typically happen, they should be happening right one after the other. So phase 3 typically takes a minute, maybe 2 minutes, it kind of depends. And what the purpose of that phase is really just to activate the memory so that your brain has access to it and then can start making adaptive connections. So do not do this right now alone. You don't want to do this unless you are with someone who actually knows what they're doing. But to explain what assessment means is because your brain encodes memories and information in a number of ways, we look at each aspect of that. So your brain encodes memories with visual aspects. It encodes beliefs, phrases, words about yourself. It encodes emotions and physical sensations. So we are doing an assessment phase where you bring up the memory. What picture represents the worst part of it? What negative belief do you have about yourself because of that memory? It's not about other people or the world, but what negative belief do you have about yourself? Like, I'm not safe, I'm unlovable, etc., etc. Then we are asking, what would you rather believe about yourself? So it could be, it's over now, or I can stand up for myself now, or I have more control than I thought. So more adaptive, positive beliefs that you can carry with you moving forward. Then we ask you, what emotions do you get right now when you bring up that memory and the negative belief, I'm unlovable, or what have you. And we also ask you to rate how intense does this memory feel to you right now, and where do you feel it in your body. So we're getting images, beliefs, physical sensations, and emotions. And because each memory is encoded in a combination of those factors, and it completely depends on the memory and the person, and some memories for the same person are encoded differently. That's why we get all of those aspects. It activates the memory, and then we say, okay, just notice the image, notice the negative belief, notice the emotions you're feeling right now, notice where you feel it in your body. And I always say, just now let your mind go wherever it needs to go. And at that point, we start the bilateral stimuli, which is in a different blog, and I'll post that down in this blog. And the bilateral, the purpose of that is to keep you here in the moment while also accessing the past. Because a lot of times what happens is you're so stuck in the past that your brain doesn't realize that it's over now. And it also doesn't allow you to use the coping skills that you already have or use the lessons that you've already learned. So if something happened to you when you were 10 and we're processing that memory and you're 25, you might actually feel like you're 10 years old in the processing because your brain doesn't have access in this moment to the adult version of you. So when we say just let your mind go where it needs to go, your only job is to let your mind wander. And if nothing comes up, that's okay. If you're thinking about Taco Tuesday, that's okay. If you're thinking about your dentist appointment, that's also okay. Most of the time, though, your brain goes to different parts of the trauma that you're working on, and it also goes pretty fast. So at some point, your clinician will stop the bilaterals, whether it's eye movements, whether it's buzzers, auditory. They'll stop and say, take a breath, let it go. What do you notice right now? And your only job is to just give one sentence of where you're at right now. We don't need to know what happened in the 30 seconds or minute before, because we want you to stay in that place where you're activated in the memory and you're processing it. So the purpose of that, you take a breath, just notice what do you get right now. I really just want to know where you're at. I need to know if you're stuck, if you need me to kind of help you through the processing a little bit, or if we're on track or what have you. For me, when we stop, I have a decision tree in my head of what's next and what we're going to do. So don't make up that something's going on that's not, because if nothing comes up, that's information for me. If you are thinking about the grocery store, that is information for me. It lets me know that, well, there's a couple things that could mean. So your only job is to just give one sentence of what's going on. Many people will say, well, I'm at this part of the memory. Some people don't process chronologically and they just go through a bunch of thoughts. Other people feel a lot of emotions. Some people feel a lot of physical sensations. I'm one of those people where I process less in images and less in chronological order, but more in I feel angry and this is where I feel it, or I have a lot of tension in my head, or what have you. So kind of to recap, your only job is to give one sentence of where you are in that moment when we stop the bilateral stimulation. You cannot do anything wrong. The clinician can do something wrong, which is why you're supposed to have a lot of extensive training before you're doing EMDR with clients, but you cannot do anything wrong. And inevitably, people always say, I don't know if I'm doing this right or not, but you're not doing it wrong. You can't do it wrong. So long story short, we reactivate the memory with images, negative beliefs, emotions, physical sensations. Let your mind go where it needs to go. Throughout the process, your EMDR therapist will stop the bilateral stimulation and ask you, what are you getting now, or what comes up now, or some version of that. And you just give a sentence. Feel really tight right here. Okay, I would say, notice that. And then we start the bilaterals again. Eventually, when you are working on that memory, there's going to be a lot less energy behind it. And the goal is that by the time we are returning to the memory that we're working on, so I'll say, okay, go back to the memory that we decided to work on today. And I'm very vague on purpose because the memory is changed typically, and I don't want to influence you. So I'll say, the time that this happened. When you return to that, typically each time we return to that memory, there's a lot less energy, and it's often changed each time we return to it. So ultimately, though, the goal is for when you return to that memory, there's either no charge or very little charge. And if we can't get the charge or the energy down, there's usually some other things going on that is out of the scope of this blog post. So that's another conversation. But ultimately, when there's very little, or I always try to get it to a sense of neutrality. Once you're there, then we look at strengthening a positive adaptive belief about yourself. Like, I am lovable, or, I did the best that I did, or it's over now, and I don't ever have to see that person again. We strengthen that belief, and then, which is called phase 5, and then we also combine the memory with the positive belief, and we'd have you do a body scan to make sure that there's no tightness or tension or energy stuck left in your body. So ultimately, you will have very low, if any, activation. You'll feel really strong and positive about the adaptive belief that we wanted to increase and work on. And you won't have any tightness or tension in your body. And most people leave feeling really light or strong, which is really good and positive. Not always, because some memories take multiple sessions to get through. We're seeing that memories can take anywhere from 1 session to 7 sessions. I've had a handful of people who can get 2 done in a session, which is pretty rare, but some people can. And it really depends on the type of memory that you're working on, how long it takes or how many sessions it takes to process that memory. Ultimately, we will go back a week or 2 later and recheck the memory and make sure that we got it all, because sometimes you're feeling so good and relieved at the end of a session that you might not notice any tension or anything that's left. So we kind of let the dust settle, and then we come back and recheck the memory. Ultimately, though, when I go and recheck a memory with people 6 months, a year later, they are pretty bored with the memory, and they're like, we don't need to talk about that anymore. That's old news. It doesn't bother me anymore. And I've had the experience of checking memories 6 months, a year, 2 years, 3 years after the fact, and they're still clear, and it's old news, and why are you bringing that up to me? So I hope that explains kind of what an EMDR session is like. It's kind of complicated because you typically only do like the first few phases really at the beginning of meeting with the client and planning for EMDR, and then you do the rest of the processing of the memories each time you come back for a session. And if you don't finish a memory, then we close it up, we bring you back to the here and now, we give you enough time to kind of feel grounded in here again, and then you come back and we restart that memory, and typically the energy is so much less because your brain continues to process the memory after the fact. It's kind of like doing a really, really good workout and your metabolism keeps going. It's the same idea, so to speak. I hope that makes sense. If you have any other questions, though, you can always just email me through my website, and I'm happy to explain things a little bit further. And thank you for listening to my ramblings. I really appreciate it.